moving right along, without further ado, I'd like to introduce our keynote speaker, and her name is Dr. Maybank. Funny story, Dr. Maybank and I had interesting ties that we did not know about, and okay. It's called the power of networking. We met, I believe it was in Dallas at a National Medical Association conference, and we just happened to be talking, and it ends up that we went to the same medical school, Temple University School of Medicine. I'm a lot older than she is, but but we went there, and we have, I guess now, the N.I.H. connection. And the Cornell, that's right, look at this. See, you never know, it's a small world. You get smaller and smaller the more you kind of go through school. But I just would like to say she's a great friend personally, a great friend of mentoring in medicine. She was the health director at Suffolk County, and now has moved to Brooklyn and is assistant health commissioner there and is doing great work. She not only has an MD, but an N.Y.C.D.H, Master's in Public Health, which some of you also may be interested in. So without further ado, I'd like to introduce Dr. Maybank.
As Dr. Holden said, I am Assistant Commissioner in New York City Department of Health, and I specifically oversee the Brooklyn District Public Health Office. And some, you might have heard there's a Harlem District Public Health Office, there's also a South Bronx District Public Health Office. And our main focus is to address health inequities that exist in these communities, because we know that these communities have the worst health outcomes in the city, and just about everything. Higher death rates overall, higher death rates among babies, higher HIV rates, higher cancer rates, everything. It's sad. And who's predominantly living in these communities? Say it. People of color, lower income people, people who tend to not have jobs or even less education. So a lot of my focus and efforts are in that area. So I don't just deal with disease and speak to patients or anything of that nature. I deal with the whole community. I deal more holistically, as they call it. Because I really believe in order to help anyone effectively, we must know our communities better. Therefore, we must know ourselves better. We must have a strong sense of self-awareness as well as identity. Dr. Martin Luther King said, in order to know where we are going, so in order to help people and guide them, we must know where we are right now. And then I take that a step further, we must know where we came from. We must know, further understand us and further understand our motivations and why is it that we do what we do. I very much understood as well and recognized the importance of one's community and one's environment that they lived in and how much that influenced their health. There was more than just beyond the patient-provider relationship. That's just one aspect of a person's health, a very important aspect of a person's health and what it can be, but it's just one aspect. What happens in the community as far as the social economic things that you guys talked about earlier. What access do they have to like fruits and vegetables? What access do they have to unhealthy foods? What access do they have to parks? What access do they have to health insurance? Those things to me it was more appealing to me, let's put it that way. And that's what I knew I needed to move towards. So I actually went into a second residency. I did preventive medicine and public health. And that residency is specifically geared towards prevention and public health. And public health is really, truly my passion. So that's my second experience. And my last experience, which is a little bit more difficult for me to share, so I'll keep it brief. But this is a passage from a book that I'm working on now. Chest fell, face relaxed. That was her last breath. A strange moment of awkward beauty. As a hospital pediatrician, I had been there many times before at the bedside or cribside, at any hour witnessing one's final living moment. But this time it was different, more tangible and overwhelming. I really knew her, and I felt as if I had let her down. 2 years ago, my aunt, she died of ovarian cancer, and part of my sadness is really based on her unnecessarily painstaking experience in the year prior to her death in navigating the healthcare system in order to just obtain basic information as well as quality service. And increasingly, I was hearing more about patients' sense of loss of control and confidence with health professionals, insurance companies, as well as the overall health system. And I felt that patients are being forced to make health decisions without a solid understanding of their conditions and potentially sometimes their options. And this experience of disempowerment, I feel, leads to a greater sense of mistrust for all aspects of the community, especially in communities of color. So I share all this with you because I truly believe that I must possess and express a good amount of humility along with compassion to be effective in what I do in public health, especially when working with community of colors who do have memories and experience of being historically exploited and mistreated by our healthcare and public health systems. My passion in public health rests with addressing these issues primarily by empowering people in communities to confidently use their own voice to advocate effectively for themselves so that they can access and use the health information and get the care that they deserve. My passion in public health comes from a very personal place that I explained before, of not feeling empowered or supported to use my own voice and seeing those around me, whether my patients or my family, struggle to get proper and meaningful health information and guidance to live a healthier life. So I congratulate all the health ambassadors rather. The work you embark on is so essential in promoting and ensuring quality and equitable health outcomes for all communities in New York City. As you've all discovered, at times I'm sure it's not easy work. Sometimes there can be scheduling issues or communication gaps. There are things that you want to talk about that maybe the community doesn't want to talk about. They want to talk about something completely different. But your skills are necessary and highly valued. You are the messenger, you are the feet on the street, the voice, and potentially a lifeline to many. You help bridge the communication gap between our well-intended but perplexing healthcare system and the well-intended but sometimes overwhelmed and confused community. I thank you for giving your time, especially in a time like this when a lot of people are struggling to give their time because they need to give them their time for themselves. And Arthur Ashe is one of my true inspirations in life, and I've admired him ever since childhood. And something that he said is, I could never forgive myself if I elected to live without a humane purpose, without trying to help the poor and unfortunate, without recognizing that perhaps the purest joy in life comes with trying to help others. I believe that we all have an inevitable dependence on those that are around us in order to flourish and to succeed and to live the healthiest life that we want to lead. I thank you again for this opportunity for tonight. I especially thank Dr. Lynn Holden. I feel truly, truly blessed and honored to know her and to work with her over these past couple of years. And again, congratulations and thank you for tonight.